units. So looking at his face straightforward, do you mind if I mark you?
No, no, go ahead.
Doctors? So we have a static line here, static line here. I call it a footprint. Then he has a static line here, a static line here, a static line here, a static line here, one here, nothing here. Then he has a static line here, static line here, one here, kind of one here. So I want you to scowl very hard like this.
Do what, very hard?
Scowling. Yes, scowl like this. But put your fingers to your ear. So when he does, it's exactly what happens. So when he does that, he has a transverse crease because of the procerus muscle. You have two longitudinal ones because of the corrugator muscles. So as I told you, the first 100 patients, you have to use a white eyebrow pencil. While he's doing this, I'm going to mark my corrugators, lateral head, medial head, medial head, lateral head. And at the apex of the mountain, I'm going to do my empty points. So the first one is intersection of the eyebrow with the inner tempus, eyebrow inner tempus. So this is here, 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 and here. And scowl very hard again. And when I look at his eyebrows, I notice that his eyebrows don't move like this, it moves like this. So that means that we will need to put 2 units here and 2 units here for the depressor supercilii. Remember what I said about men. Men are different from women. Why? Because we have very low set eyebrows. And the best way to judge this by doing this simple test. I'm going to put my hand right here and press very hard and look at the doctor. And I want you to open your eyes. How that feels?
Pressure.
When you did Botox before, did you have this in the first week or so?
Like this pressure?
Yeah, kind of.
Yeah, a little bit.
A little bit. So you don't want patients to feel that because they will come back complaining. If I put my fingers again, 2 centimeters from the eyebrows, open your eyes. How's the pressure?
Yeah, very different.
Very different. Remember what I said. Every bull eye effect 1 centimeter around the point where I inject. So, looking at the forehead, I already injected the procerus. So this point will paralyze everything around it in a 1 centimeter radius. Same thing here. Everything will paralyze in 1 centimeter radius. So, although I charge $300 per area, I still make good money if I charge $500 for 2 areas because this one area already have paralyzed most of the frontalis. Lift your eyebrows up, please. You see the lines that I marked before? Lift it up all the way. In men as well, very important with temporal recession. Lift up all the way. You see there's fibers all the way up to here. If I miss these, you will have what we call the devil's horns. The devil's horns. Because we paralyze the whole muscle and forgot about these temporal recessions, you will come back with 2 horns here, which is the fibers of the muscle. So what I'm going to do, lift it up again. I'm going to mark here in the central line, lift up all the way. I'm going to skip one and do this because this and this with the bullseye effect will cover each other. Lift it up. I'm going to go 1 centimeter lateral, 1 centimeter lateral. I'm sorry, keep it up. Here, 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 and here. You see that little arch here? If I don't inject here, his eyebrow will be feminized because the fibers lift the eyebrow up, not just the rest. The lateral fibers lift out the lateral eyebrows. Okay, now I want you to smile. You see, he's a great smiler. He doesn't open his mouth. See the difference? I keep smiling. This is what I see here. You see the line here? Yeah. So I'm gonna go 1 centimeter behind his outer canthus. 1, 2, 3. And his profit is not all the way to hairline, so I only need 1 now, right? Do it again, please. 1, 2, and 3. Close your eyes, please. And I'm gonna do the compression test on the eye. Very, very mild herniation. So it's a powerful muscle. Open your eyes. He has infraciliary light, so I can actually go and put 1 unit here. This is actually advanced level, so you don't want to do it in here, but I'm just telling you. You see, when he smiles, you can see hypertrophy of the palpebral part of the orbicularis oculi muscle. It's actually a lump, it's a line. This muscle here is hypertrophic. So when you soften it up, at the age of 51 like me, you will not have a lot of wrinkles. He's 44. As age progresses with disuse of the muscle, that muscle will create more and more static lines. Okay? So these are the 3 areas where we can apply order. Lift up your eyebrows again. I probably will put 1 here just to be safe. Okay? So we will not have that elevation, right? So comes to the preparation of our product.